Welcome to the spoken tutorial on continuation of skin-to-skin contact after surgery. In this tutorial, we will learn about steps to continue skin-to-skin contact after the surgery is complete. In this tutorial, the operating room will be called OR. Skin-to-skin contact will be called STS. Let us begin. Early STS in the operating room is important for the mother and the newborn. Its benefits and procedure are discussed in other tutorials of the same series. Please visit our website for more details. Now, let's discuss how to continue STS after completion of the surgery. At this stage, the sterile drape has been removed. The mother is ready for transfer to the stretcher. She will be taken to the recovery room on the stretcher. Before sliding the mother onto the stretcher, the baby should be repositioned. The nurse should slowly and gently move the baby's legs to a vertical position. Baby's head should be between the mother's breasts. The mother can cross her arms over her baby. The nurse can place her hands on the top of the mother's hands. This will secure the baby during the mother's transfer to the stretcher. Now, she can be slid over to the stretcher. This is a simple process. The baby should never leave the mother's chest during the transfer. She can be in the same position on the way to the recovery room. So, the baby continues going through the 9 stages towards the first breastfeeding. There are 9 natural stages or behaviors of a baby after birth. The first stage is the baby crying immediately after birth. The second stage is relaxation, during which the baby is very quiet and still. Third stage is awakening, which starts with small movements of the baby's head. The baby opens her eyes and shows some mouth activity. Fourth is the activity stage, during which the baby opens up her eyes widely. She touches the mother's chest with her open mouth and lips. She shows increased suckling movements. She turns her face towards her mother's breast. Fifth stage is resting, in which the baby rests until she is ready to move again. Sixth stage is crawling, in which the baby tries to reach the mother's breast. After reaching the breast, 7th stage, called familiarization, begins. In this stage, the baby licks, touches, and massages the breast and the nipple. Then, baby latches deeply to the breast to begin the 8th stage, called suckling. Lastly, the 9th natural stage is sleeping. Baby should never be lifted from the mother's chest. Ensure 1 hour of uninterrupted STS in the immediate post-delivery period. At least this 1 hour must be given to the mother and the baby. Otherwise, the baby may become distressed and lose focus. It could interfere with the adaptability of the baby's body after birth. Before birth, baby was in the protected, calm, and warm environment in the womb. Her body has to adapt to a bright, noisy, and cold life outside the womb. When the baby is replaced, the 9 stages must start all over again. Baby will have to advance through all the stages once again. Doing this second time will be quicker. However, this will delay breastfeeding. About 1.5 hours to 2 hours after birth, newborns fall into deep sleep. However, sleeping is the last of the 9 instinctive behaviors. The 8 instinctive behaviors must be complete before the baby sleeps. If she has been interrupted several times, the baby may not complete them. Baby will not experience suckling before sleeping. It will happen several hours later when the baby awakens. After the baby awakens, she should be placed skin to skin again. Baby will go through all the 9 stages again. She will find the breast and attach deeply. This instinctive behavior may be present for the first 4 to 6 months after birth. This behavior should be encouraged, especially in the first few days. This will help the mother and the baby grow accustomed to breastfeeding. In the first few days, only STS is ideal for successful breastfeeding. It will activate the baby's instinctive feeding behaviors. This will help the baby to quickly learn how to latch correctly. Later, the baby will be able to consistently latch deeply even without STS. This brings us to the end of this tutorial. Thank you for joining.